And similarly, I think we can't do away with standardization, science, measurement, rules and restrictions, etc. And you can actually see in some indigenous contexts that the lack of those can be concerning. And it's not like the Western world is just like this bad place and the indigenous world is this good place. Like, it's definitely pros and cons of both. So how we mix those is going to be interesting. But I think particularly in regards to psychedelic facilitation and context and integration, some of the things that we lack in Western society are reflected. So just a lack of connection to nature. Like, already I think we're seeing in ketamine clinics and how we're facilitating some of the things that are legalized, nature is not like a big part of the encouragement or values. And I mean, can't say like wholesale, but like largely, like there's not like, okay, if you're doing ketamine, you're gonna do it in nature. Like, it's definitely not like that, right? But if you're in a lot of places in indigenous context, you're going to be in nature for sure if you're doing these experiences, and you're going to be within a system of like tribal kind of identity or just community. Like some form of community is going to be around you. And there's probably going to be somebody who's worked with the plant a lot of times. And none of those things are present in the way that we approach the medical industry. Like, our psychiatrists don't have to do SSRIs hundreds of times, for example. But if there's a facilitator, they should have experience with that particular substance, like, and a lot of experience with that to really know the ins and outs of how that plant works and what people are going through when they're navigating it, and how to help shape and direct the energy as the person is in that experience. And holding that within the context of a community and connecting that to nature, which is really like, we feel so disconnected in a lot of ways. Like, these elements are super important and they're not really a part of our medical model. So that's where I guess I'm speaking to. I hope that as we combine these two things, there's probably more emphasis than I anticipate will be given to some of the things that we're not familiar with as familiar with as a culture. Yeah. So I guess if I think about the clinical approach as it is held in Western society, some of it just being clinical, it has a focus on clinical issues. So as I mentioned earlier, what is going wrong, what is bad. And it's really important to be familiar with that side of things, because a lot of people are coming to these experiences out of a desire for healing. So obviously being familiar with the world of healing is very beneficial for sure. And then if I think also about clinical side and like how it's held in Western society, like with the rules and regulations and accreditations, I think there's some form of commitment, responsibility, and professionalism that is required to jump through those hoops. And if people can't demonstrate that, then there may be concerns. Not necessarily, but there could be concerns about how rigid they will be in their ethics or their attention to detail, or things that are important for the psychedelic experiences, and being kind of like a legitimate provider. And I think we see a little bit of that, a little bit or more, I don't know, currently with sort of a wild, wild west of facilitation, and partly out of the legal status, right? Because it's not legal, we're going to just whoever I heard is serving ayahuasca, or, kind of that's the approach now. And there's a lot of people probably who they might not make it through those hoops, and maybe that is also reflected in some problems that are coming up in those ceremonies. And in indigenous context, I think like there's a different sort of filter, which is the filter of being able to get through the initiation dietas and rituals. So for example, the Yawanala tribe has a dieta called the Mukta dieta, and that's a year of, I don't know the exact details of this, but it's something along the lines of like a year of a really strict diet, really strict abstinence, being in the jungle by yourself for a long period of that time, taking ayahuasca every couple of days. So like deeply, deeply immersing yourself, surrendering your body, to the experience. And you have to have a lot of commitment to learning to be able to jump that hoop. It's not just like anyone's, I had a good ayahuasca experience, so now I'm going to do this. Like that's got to be your life path. And you have to it's got to be in some way selfless because you're sacrificing so much. So that's the means through which they create a filter. And I think that filter maybe speaks more to the heart and the quality of person and their like real dedication. And the filter that I think Western society applies often may speak a little bit more to financial means, a little bit more to ability to like sacrifice and compromise to be able to get through kind of like rigid regulations and restrictions. And it leaves us with a little, maybe less validation of like heart, character, soul. But it does address some other important elements. So I think how those are woven together will be a very interesting question.